It seems as though members on both sides of the House have been experiencing very similar problems in the hospitals that they're serving. Years of underinvestment have ended up in many hospitals having leaking roofs. My friend from Torbay was talking about sewage in clinical areas. We thought sewage was the next debate. It seems outrageous that we're discussing sewage in our hospitals right now. And my friend from Oxford and Aberdeen West talked about a room full of incubators where they had to be removed because the ceiling was at risk of collapsing. It is absolutely crazy that we've got operating theatres and hospital rooms that are not being used not through lack of staff, but because they're not safe enough to be working in. I meet regularly with the hospital leaders and managers of our local hospital in Winchester and discuss the issues that they're facing. And despite the heroic efforts of the staff at the Royal County Hampshire Hospital, they are really facing a similar set of issues that have been brought up time and time again this afternoon. We also have leaking roofs over treatment areas. Like my friend from Epsom, we have old and outdated lifts that fail, causing issues transporting patients from wards to the operating theatre. We've got no backup power generators, and that risks patient safety during power cuts. Now, these are not all minor inconveniences. They're daily threats to patient care, and they cost us dearly. So why aren't we fixing them? Because failure by the last government isn't an excuse for continued delay, and saying we can't afford it when the cost of inaction is higher is simply nonsensical. Because the longer we wait, the more it'll cost the taxpayer. And a lot has been said about trust in politics. And we won't forget what happened in our area of Hampshire, where Conservative MPs stood on manifestos of delivering a new hospital that they never had any funding for. There was no funding secured, no shovel-ready plan, but they repeatedly campaigned on this anyway, hoping the voters wouldn't find out until it was too late. Now, other members have discussed that GP surgeries are particularly neglected. Funding was allocated in the budget for just 200 additional upgrades. That's out of 6,000 GP surgeries. And with the government's jobs tax hitting GPs, it's becoming harder for those practices to self-fund the improvements. But I was very pleased to see the member for Stroud to bring up the importance of primary care and mental health, because I know we have cross-party agreement on this, that investing in primary care, although this is a debate about hospitals and hospital infrastructure, that keeping people healthy in the community, whether it's primary care, mental health, public health, that is much more cost-effective for the taxpayer as well as being better for the patients. And we really welcome the warm words on social care from the Minister. We had a social care roundtable just yesterday where we're discussing that for every £1 spent on social care, it saves the NHS £3. And so we urge that we have these cross-party talks as soon as possible, because every year we delay in getting a plan for social care, it is costing us a huge amount of more money while the people are languishing in hospitals of delayed discharge. We have to end this vicious cycle of false economies and fortunes being spent on papering over the cracks. The total repair backlogs at the delayed new hospital sites could reach an estimated £5.7 billion by the time construction starts. And is the government really of the view that keeping these hospitals on life support is a good use of taxpayers' money? Now, repairing and replacing crumbling NHS buildings isn't just about treating more patients. It's about reviving and boosting our economy. Because here's the truth. We know we won't grow our economy unless we reinvest in the services that support it. So let's change course, because we urge the government to reverse the long delays in the new hospital programme, because many are not going to be open until the 2040s at the current timeline, and those hospitals have to be kept functioning up until then. Set out a 10-year investment plan to fix hospitals and GP surgeries, urgently release funds that have already been committed to start construction straight away, and publish a plan to recruit and retain a skilled workforce to carry out this work efficiently. Because this is what investing to save looks like. It means improving care, lowering long-term costs and building a stronger, healthier economy. Now, the Conservatives, they chose to cut investment, and that led to higher costs. Now, our plan is to increase investment now so that we can lower costs in the future. We urge this government not to simply patch over the damage to our NHS, But as the Liberal politician William Beveridge, who was a visionary behind the formation of the NHS, said, a revolutionary moment is a time for revolutions, not for patching. So let's be bold, let's invest now. It'll be better for the taxpayer, it'll be better for patients, and it will boost our economy. Yeah.